pebble-like deposits of material that form in one or both of your kidneys. These deposits are usually mineral and salts from your body. Kidney stones form when the urine is concentrated. Because minerals and salts in the urine crystallize, which stick together to form pebble-like deposits. Kidney stones have many causes and can affect any part of the urinary tract from your kidneys to your bladder. On an average, 6% women and 12% men are affected with kidney stones. Symptoms of kidney stones include sharp pain in your back, side, lower abdomen, or between abdomen and upper thigh, a constant need to urinate, inability to urinate or can only urinate a small amount, pink, red, or dark color blood in your urine, pain while urinating, cloudy or bad smelling urine and vomiting. Treatment for kidney stones begin mostly if the pain is unbearable, for which your doctor may prescribe medicines to get relief from the pain. But if the kidney stones are affecting your kidney function, your doctor may suggest surgery. Preventive measures for kidney stones are by drinking plenty of water, eating moderate amount of calcium-rich food, reducing foods like nuts, peanut butter, strawberries, etc. Avoid eating too much red meat. Lower salt intake. If you have experienced any one or more of the above-mentioned symptoms, please consult your doctor. Prostate cancer is a cancer that occurs in the prostate gland of men. Prostate gland is a small walnut-sized organ found below the urinary bladder and surrounds the urethra. About 3 in 10 men are diagnosed with prostate cancer during their lifetime. Prostate cancer affects mainly older men of over 65 years of age. Symptoms of prostate cancer include difficulty in passing urine more frequently than usual, especially at night, feeling of incomplete emptying of bladder, blood in the urine or semen, pain when passing urine or ejaculating. Treatment for prostate cancer can be carried out by surgery to remove the tumor, radiotherapy, where high-energy X-rays are used to destroy the cancer cells. Chemotherapy uses anti-cancer drugs to destroy cancer cells. Targeted therapies destroy cancer cells, usually by interfering with the cancer's ability to grow or survive. If you have experienced any one or more of the above-mentioned symptoms, please consult your doctor.
Interstitial cystitis, IC, also known as painful bladder syndrome, is a chronic or long-lasting condition that causes painful urinary symptoms. In a normal, healthy person, the bladder is a hollow, muscular organ that stores urine, which expands when it's full. At this point of times, the brain receives signals through the pelvic nerves to urinate. But with interstitial cystitis, these signals get mixed up, making you feel the need to urinate more often and with smaller volumes of urine than most people. Exact cause of interstitial cystitis isn't known, but it's likely that many factors contribute, such as a defect in the protective lining epithelium of the bladder, which may allow toxic substances in urine to irritate your bladder wall. IC is quite common and most often affects women. Female to male ratio of interstitial cystitis in India is 3:2. Symptoms include pain and pressure of the bladder and pelvis, pain and pressure in the genital area, urgent and frequent urination, pain during sexual intercourse, chronic pelvic pain. If you have experienced any one or more of the above-mentioned symptoms, please consult your doctor.
Overactive bladder (OAB) is a medical condition when the muscles of urinary bladder contract without warning at wrong times. This happens because of weak pelvic floor muscles. Pelvic floor muscles are the layer of muscles that support the pelvic organs such as bladder and bowel in men and bladder, bowel, uterus in female. When pelvic floor muscles are weakened, a complete support is not provided to the organs and pose difficulty in controlling the release of urine. Weakening of pelvic floor muscles is caused by age, pregnancy or childbirth, obesity, constipation, chronic cough, heavy lifting. OAB is known to be more common in women than men. Symptoms of OAB include urinary urgency, sudden strong need to urinate immediately, urinary frequency, urinating 8 or more times a day, urinary incontinence, leakage of urine that follows a sudden, strong urge to urinate, nocturia, urinating 2 or more times at night. If you have experienced any one or more of the above-mentioned symptoms, please consult your doctor.
Premature ejaculation is an uncontrolled ejaculation either before or shortly after sexual penetration. It is known that there is an overall prevalence of 25.6% among the Indian male. Symptoms of premature ejaculation includes uncontrolled ejaculation either before or shortly after intercourse begins, ejaculation occurring before the person wishes it with minimal sexual stimulation. Some of the known causes of premature ejaculation are having sex with a new partner, a long time gap since the last ejaculation, psychological factors such as anxiety, guilt or depression, medical factors like hormonal problems or an injury. Treatment or advice for premature ejaculation are adhering to medicines prescribed by the doctor, discussing the problem with your doctor, increase the frequency of sex, wear a condom to reduce its sensation. During intercourse, let your partner be on top. Practice the squeeze technique. That is, just before ejaculation, the head of the penis should be squeezed for 1 to 20 seconds. Or the start-stop technique, which is similar, but you simply stop the stimulation or the intercourse just before ejaculating. If you have experienced any one or more of the above-mentioned symptoms, please consult your doctor.
A urinary tract infection, UTI, is an infection in any part of your urinary system. The urinary system includes kidneys, ureters, bladder, and the urethra. UTIs are among the most common infections in humans and are mostly caused by bacteria. But some are caused by fungi and, in rare cases, by viruses. Women are at greater risk of developing a UTI than men are. Around 25 to 30% of women between 20 to 40 years of age will get UTI. Symptoms of UTI include pain or burning when you urinate, fever, tiredness or shakiness, chills, an urge to urinate often, pressure in your lower belly, urine that smells bad or looks cloudy or reddish, pain in your back or side below the ribs. Antibiotics usually are the first-line treatment for urinary tract infections, for which your doctor will advise you to finish off the prescribed cycle of medicine completely even after you start to feel better. Preventive measures for UTI include: drink 6 to 8 glasses of water daily. Don't hold urine for long periods of time. Talk to your doctor about managing any urinary incontinence or difficulties fully emptying your bladder. Consult your doctor if you have any one or more of these symptoms as